Okay, which of the following is the most appropriate initial treatment for this patient? A 16-year-old girl complains of persistent pain in her right tibia that is worse at night and relieved by ibuprofen. On physical examination, there is a mild tenderness over the proximal tibia, but no visible deformity or erythema. An X-ray reveals a small radiolucent lesion with a central nevus and a sclerotic rim. Which of the following is the most appropriate initial treatment for this patient? Surgical excision, chemotherapy, radiation therapy, conservative management of the NSAIDs, or intravenous bisphosphonates. There is a for sure disease. It's rather osteoid or osteoma that is exactly this. It is relieved by ibuprofen. It is worse at night. I don't remember exactly which one is between it, but let me see if I can answer it without knowing 100%. Um,
And by the way, this is a little bit more, and I'm going to say this also for the YouTube channel that this is a little bit more step two, I would say. Definitely for sure a step two type question. But I think that using kind of some of the clues here, you should be able to still be able to get this right. So
mhm.
first start with the diagnosis. What diagnosis do you think it is?
Again, I'm not sure between rather osteoma. I forget which one. I'm thinking uh, osteoid is more
Okay.
on the face, or I don't know.
Yeah, so that diagnosis I like, osteoid osteoma is kind of the one that I would be thinking about here.
Okay.
So
Osteoid. Okay. So with that, I don't really 100% know now still.
okay,
Okay.
so use the question itself and see if that can help you get it right, right? 16-year-old persistent pain, you already know it's an osteoid osteoma, and it's relieved by ibuprofen.
Yeah,
Mild
and there's
tenderness.
no visible deformity or erythema. It's
Okay.
just it's just persistent pain, I guess.
Yeah, so what do you want to do?
I
If
mean,
you
if it's relieved by ibuprofen, maybe just conservative management with NSAIDs and like instead of going straight to surgery.
Yep. Yeah,
Okay.
it's just, eventually these should be able to go away. It's a benign thing, right? You're not going to cut it out. That's too crazy. I mean, you can do it if it, significant impairment and it doesn't go away. Sure. Chemo, heck no, right? It's a benign thing. Radiation, heck no. And then IV bisphosphonates, right? This is more like osteoporosis, hypercalcemia, things like that, where you want to prevent bone reabsorption. But yeah,
Mm.
this is more of a step two type question. But I feel as though, if you kind of break it down in a sense of this, where it's like, okay, first get the diagnosis, osteoid osteoma, and number two, right, on a step one exam, you should know the basic treatment of diseases, right? So it's going to be NSAIDs.
Perfect.